you're doing gene therapy on yourself for good or for harm every time you put food in your body. Vitamin D is one of the most important things that costs pennies a day. The refined sugars wreaking havoc on those gut bacteria. Spices, herbs, things from nature, you could turn on genes that would suppress cancer.
After 25 years of serving patients through integrative medicine and oncology, at Gaynor Wellness, Mitchell amplifies the awakening of harnessing the medicinal nature of whole foods, food as medicine. In his book, The Gene Therapy Plan, he peels the onion with deeper, untapped, and profound new information that is truly leading the discovery towards empowering each of us to take control of our own genetic destiny.
Being a doctor, being a physician, being a surgeon is an enormous privilege. It's a gigantic responsibility. And what we get to do, which is, I think, quite unique, is we get to bear witness with humans as they're going through very, very difficult situations. So let me talk a little bit about Mitch personally. So we've known each other for a long time, and we've intersected in many different venues through the years. So as you all, I hope, know, that he's an extraordinary human being. He's deeply scientific in his background, but he has a rare blend of qualities where he has amazing insight and intuition. And he really rejects dogma in a lot of different areas while still having a scientific approach. Mitch is always ahead of the curve, and I think, you know, you're batting close to 1,000 from my perspective, because you're always right. I want to also introduce Devra Davis, who I've known Devra for a long time. Dr. Davis established the field of environmental oncology. So why don't we bring up Dr. Gaynor and Devra Davis to come up.
Well, good evening. It's really an honor to be here. Mitch Gaynor is a dear friend, and I can tell you he is a mensch among mensch. He really is. He's a brilliant scientist, and I first met him when he had just finished at Rockefeller University, and we were both at the Strang Cornell laboratory doing work, in fact, on xenoestrogens, pioneering on some of those early studies suggesting that there must be something going on, because after all, 1 out of 10 women who get breast cancer has inherited it. Only 1 out of 10. 9 out of 10 women who get breast cancer are born with healthy genes. Did you know that? Only 9 out of 10. That is why you all have to read this book. This book is going to change your life. It's going to allow you to save the lives of people you care about. Because what Mitch has done in this amazing book is to take complicated science, explain it in clear, coherent ways so that you will understand why your inheritance is not doom. You inherit genes, but whether or not you get cancer depends on what you eat, where you live, and what you do with your lives. Because genes give us the gun, but the environment pulls the trigger. Tell us about your mom.
Well, she was the inspiration really for my life's work, and I actually dedicated the gene therapy plan to her. And I start the book by talking about how she had developed breast cancer when I was about 6 years old and succumbed to it when I was 9. And she had been given a drug when she was pregnant with my brother called DES. So that was 6.5 years before I was born. For those of you that don't know, because DES had since been taken off the market, it was given to women who were pregnant to help make the pregnancy easier. It was later, when I was sitting in a college chemistry class, that the teacher said, you know, they just took DES off the market, and could you believe that they knew that it was a carcinogen from the time they released it onto the market? And so, you know, that was very shocking, and it was also by epigenetic means that this happens. And epigenetics, epi means above. Above the genome. The genome is the collection of our DNA. And what we used to think is that if we had a family history of being overweight, of cancer, of diabetes, of heart disease, of Alzheimer's, that was just our destiny, just like our hair color and our eye color. But it doesn't have to be that way. And the reason it doesn't have to be that way is your genes are vibrant, like life itself. And they change, their expression changes throughout your life depending on the foods or the toxins that you're putting in your body. So Devra really enlightened me when we first met because I had been studying nutrient-gene interactions at String and Cornell and Rockefeller, and I was flabbergasted how, with the best medical training in the world, could nobody have taught me that there were all these micronutrients that you can put in your pantry, in cinnamon, in garlic, in broccoli, in turmeric, and then in some more obscure things that we'll talk about later. But in all these spices, herbs, things from nature, you could turn on genes that would suppress cancer, turn off genes that would promote cancer. And then I started finding all the commonalities that were the same between cancer and diabetes and heart disease and premature aging. So really, what was a very big adversity for me as a child in losing my mother, it caused me to ask the question, why does this happen in the first place? It's not enough just to practice cookbook medicine or just wait, the way medical science has evolved for a symptom to develop. I often tell people stomach ulcers aren't due to deficiency of antacids or acid blockers. Feeling tired all the time isn't due to a deficiency of amphetamines. There are basic reasons that people have a number of the ills that plague us: chronic fatigue, premature aging, joint pain, forgetfulness earlier in life. And it's really possible through epigenetics, through taking control of your genetic destiny, taking control of genes that protect you against all these things, to live well into your 80s and 90s, but not just live to be that old, but to be vibrant and healthy until that age.
I first met Mitch, and he was introduced to me as having been the chief resident at Sloan Kettering, and he was at that time the cancer doctor that cancer doctors went to when they were told to go home and die. Okay? If they had advanced cancer, they would go see Mitch Gaynor. How do you explain, Mitch, that we don't have all the evidence that these things work? Why is it that you're using things that we may not have definitive proof on? Why shouldn't people wait for more evidence? What would happen if we said you had to wait for evidence before you gave people coenzyme Q10 or metformin? And let's talk about those two as an example. Maybe explain what each of them does and why you decided 10 years ago that you wanted people to use those drugs, and why the world of medicine is now caught up to you.
Well, now there have been randomized trials. So we know, for instance, it's standard of medical care. If you're on a statin, for instance, for high cholesterol, you take CoQ10. That's become mainstream medicine. But when I started doing it 20 years ago, it's like, what is CoQ10? Don't take that. Dr. Gaynor put you on CoQ10? How do you know what's even in there? And it was just, there was so much data. And as a doctor, I have seen so many people. I've had people come in with heart failure from chemotherapy and other types of drugs that I've reversed with CoQ10 and other nutrients. And yet the doctors that they were seeing besides me say, well, don't take them. You don't know what's in them. And, for me, it's always been my responsibility, because I took that oath too. We have to take care of patients in real time. We may not have 20 years for randomized controlled trials when somebody can't breathe who's sitting right in front of you because they're in heart failure. And if you know and understand the science that can help them, you give it to them. And it's really that simple. And we know, for instance, fish oils and omega-3s, absolutely critical. Some people aren't going to have access to fish. You can buy very high-quality fish oil supplements without PCBs, without mercury in it, that are great to take. But yet you have people that say, no supplements at all. One of the most important things, just as far as supplements that people need to be taking, all this is in the book, but is vitamin D3. What you measure for D3 is a 25 hydroxy vitamin D level in your blood. All of you should know that several times a year. Between November and April, for those of us living at this latitude, we don't make any vitamin D. And almost everybody I check, I did a book signing last night in Portsmouth, New Hampshire. One of the orthopedic surgeons there had heard me speak, and he started checking vitamin D levels. He said he had one patient in the last year with a normal vitamin D level, and that was in the 30s. Should be between 50 and 80 at the very least. We know low vitamin D levels are associated on an epigenetic basis. Again, this is at the control of gene expression. Brain cell loss, immune function, every type of cancer that's the most common type of cancer, heart disease, insulin sensitivity. We have 100 million Americans who are either pre-diabetic or diabetic, a third of the country. And vitamin D is one of the most important things that costs pennies a day, but you can't guess about the dose. Everybody absorbs it differently. If you eat a perfect diet for vitamin D, salmon, cottage cheese, yogurt, the most you can get is 350 units. The least anyone needs is 1,000 units, and many people need 5,000 or 7,000 units. I have to take 50,000 a week because I don't absorb it well. So, there is hard science for this.
So do you think that, as an example here, that a test for vitamin D should be a routine part of blood work, just as they do the white count and cholesterol?
It absolutely should be, but I was at the book signing last night also in New Hampshire. A nurse practitioner with a large practice told me, and I was unaware it was that way outside of New York State, nurse practitioners here have told me they're not allowed to order vitamin D levels because insurance companies won't pay for it. Yeah. So it's restricting access to something that really is a human right. There was a woman named Kathy Helsauer who at Johns Hopkins compared women with and without breast cancer. And she looked at a detoxifying enzyme called GST, or glutathione S transferase. So your detoxifying enzymes are in every organ system in your body. So if you're breathing in polluted air or secondhand cigarette smoke, hopefully not firsthand cigarette smoke. Do you hear that, everybody? There were people that was directed more to than others. Your glutathione S transferase is what breaks down the main carcinogen there, benzopyrene. Some people don't have as much glutathione S transferase, and the amount that you have is dependent on a lot of foods you put in your body, because the genes that code for glutathione S transferase can be induced by garlic, by omega-3 fatty acids, by turmeric, which is what gives curry its yellow color, by blueberries and blackberries. They markedly raise on an epigenetic level the body's production of detoxifying enzymes. So what Kathy Helsauer at Hopkins found is that women with the lowest levels of GST had a 4-fold increased incidence of developing breast cancer. Similar studies have been done for other cancers, and we know you can induce detoxifying enzymes. Again, this isn't taught to most doctors in medical school. I just feel very fortunate. I happen to have trained at Cornell, been able to go to Rockefeller, do research in molecular biology, then be at String, work with people like Devra so closely about environmental toxins, because the dark side of epigenetics is called toxicogenomics. Devra was the first person in the world to introduce me to that term. And that was 25 years ago. But since then, we know all the things that we're talking about that micronutrients do. All the white sugar that you eat, the refined sugar, the refined flour, the pesticide residues, the herbicide residues, the dioxin, all the things in the external environment, they induce tumor promoter genes, they induce inflammation. So why is inflammation bad? Inflammation is bad because the inflammatory chemicals that are released when your body's inflamed from too much white sugar, white flour, and chemicals, they literally gunk up. They occupy the insulin receptor substrates. That's inside your cells. So your insulin can't work. Your pancreas responds by making more insulin. And so you're hungry all the time because your blood sugar drops, but the insulin, it can go to the cells, but it can't work because of all the inflammatory chemicals. That happens on a gene expression level too. So a lot of things you can do to inhibit inflammation. Take a probiotic. A lot of inflammation starts in your gut with a dysbiosis, the wrong bacteria in your gut. You want to make sure you're getting enough acidophilus, bifidobacteria, lactobacillus. What foods can you have for that? And again, this is all documented.
What are some of the foods that contain probiotics? Because there's some
Yogurt.
surprises like sauerkraut.
Sauerkraut's one, miso is one, Greek yogurt with kefir cultures added, no added sweets. Those are all good things for getting probiotic bacteria, but you also want to take prebiotics. Prebiotics are good nutrients for the bacteria in your gut. You should think of your gut like a very delicate rainforest. It's a delicate ecosystem. So every time you go to a vending machine and you get a can of soda, even if it's diet, you're drinking all this phosphoric acid. It just wreaks havoc on the gut bacteria. Every time you eat a package of donuts or something from a vending machine, the refined sugars wreaking havoc on those gut bacteria. You not only have to replace them, you have to replace those foods with things like apples. You can make your own apple juice, grape juice. I'm big on juicing. I have a lot of juicing recipes in the book. And these are the types of food that you're doing gene therapy on yourself for good or for harm every time you put food in your body. So gene therapy is not some concept that's 50 or 100 years away, or that's going to come from some big pharmaceutical company. All of you are doing gene therapy for good or for harm every time you eat. And while we may not be able to control our external environment, such as the air we breathe, we can control our internal environment by the foods that we're putting in our body.
You have a couple of examples in the book of how you were able to use foods for some unusual situations. Perhaps the story of your father and his disease. Tell us about that.
Yes, that was truly amazing and unexpected. He was a dentist and he stuck himself with a suture needle and the patient had hepatitis C. That was in the days before there were cures. Now it's hepatitis C. Okay, you go and you take medicine for it and it gets better for the most part. But this was in the early 1980s before there was any thought of any medication, much less thought of a cure for it. And his liver functions were quite high and he had the virus, and I put him on a number of algae, seaweeds, grass juices, mushrooms, things for the immune function, a lot of turmeric, a lot of things to help with liver injury, resveratrol that comes from the skin of red grapes. I mentioned turmeric, omega-3 fatty acids. Anyway, he did that, and in 3 months, there was no trace of the virus. And as tests became better and better, and we were able to do things called PCR, there was still no trace of the virus ever for the rest of his life. He ended up living till 89.
Metformin is used for diabetes because it lowers the amount of sugar in the body, right? How did you figure out that it would be a good idea for metformin to be used to prevent cancer and to help treat people with cancer? How'd you figure that out?
Well, again, it's fascinating because I still write prescriptions for metformin. Now there, as Shelley said, there's all these big randomized controlled trials, and there's paper after paper in the best oncology journals showing that metformin, which originally came from an herb, it came from the French lilac, and when it was released in Europe in the 1950s, it was 1955, they started noticing over the ensuing decades that people on metformin that were taking it for diabetes had 40% less cancer than the rest of the population. So that was known for decades. So I knew that literature and started looking into what metformin did on an epigenetic level. And the data for that was there too. You talk about connecting the dots, and I talk about this in the book. So metformin is able to induce a gene called AMPK. AMPK is the top of a whole cascade of other tumor suppressor genes. So metformin costs $0.05 a day. You can take a lot less if you're not diabetic, and you can keep from ever becoming diabetic with that. You can lower your risk of cancer. The people on metformin have a 62% reduced incidence of pancreatic cancer, which has been increasing, and I'm seeing it in younger and younger people the last 10 years. There was a study published in the Journal of Clinical Oncology. They looked at women with very large breast tumors that needed what's called neoadjuvant chemotherapy to shrink it down. They were inoperable. And I started giving metformin to these women as well, and started seeing the chemo work like that, like very, very quickly. Now we give it for people preventatively. I take metformin every day. And what the study in the Journal of Clinical Oncology showed, they just wanted to see how women with these large breast tumors that were diabetic did. How do diabetic women do with chemotherapy? But when they analyzed the data, they found that women that were on metformin, as opposed to the newer oral anti-diabetic drugs, Actos, Januvia, or insulin, they found they had an almost 3-fold increased pathologic complete remission rate. That means there was no cancer, even under the microscope, detectable when they went for a lumpectomy or a mastectomy. 3-fold increased risk. And, you know, to my amazement, still the majority of doctors that'll see patients on metformin and they're not diabetic will say, there's no evidence for that.
In part with what we understand about how sugar can feed cancer and how it can feed a lot of inflammation in the body. And so your book is full of very interesting recipes. What's one or two of your favorite recipes in the book?
I'd say probably my favorite one is one that my mother taught me. So after she was diagnosed with breast cancer, she taught me just simple juicing. And so you can get a cup of grapes, for instance, put it in a blender, and blend it for about 30 seconds, then pour it through a strainer, use a spatula to get all of the pulp through that you possibly can, and you have grape juice with no added sugar, no high fructose corn syrup, no BPA, which is a chemical that comes from a lot of plastic bottles. It's just pure grape juice. Grapes are one fruit, though, I would say always buy organic. There's a list of some that you want to always get organic. That grapes is one. The other is apples. You can make your own organic apple juice. Best to use either Granny Smith apples or probably the highest quercetin content. Put 2 apples in a blender. Pour that through the strainer. Use the spatula to get everything through. You've got organic apple juice. It tastes great. Again, none of the contaminants are there. So I talk about a lot of juicing recipes. Everything in the book largely stems from what my mother taught me, because she sensed that she wasn't going to be around to take care of me. So they're simple recipes. Trust me, if I can make these, anybody can do them. Anybody.
The most commonly used pesticide in the world today, it's called Roundup. Many of you may be aware of it. The generic name is glyphosate. It doesn't just occur in Roundup, it occurs in many other pesticides. And an expert committee of the World Health Organization looked at all the evidence available, and looking at experimental evidence in cell cultures, which they are subject to exposure under controlled conditions, in whole animals, which are exposed under controlled conditions to see what happens to them, as well as in humans. And they concluded that this most commonly used pesticide in the world today is a probable human carcinogen. A probable human carcinogen. Now, in the past few weeks since that determination came out, you've seen stories in the New York Times, Business Reporter, that the World Health Organization really is way out of line here. Now, I want to talk with you about the idea, why do we study animals to predict human responses? How we do that when we develop drugs. We use animal research to develop drugs, right? So what's wrong with using animals to predict human effects with environmental chemicals? And what is your view of what we need to do about things that look like they cause cancer in humans based on animal evidence? What do we do with animal evidence? Do we act on it, or should we wait for proof of human harm?
Well, the consequence of waiting for human harm is very well known. Shelley has done pioneering work on looking at pesticide and herbicide residues in breast fluid and breast milk in American women. And there are dozens. If you look at fatty tissue samples from Americans, men and women, from surgery, there are 80 to 100 pesticide, herbicide residues, chemical known carcinogens that we're walking around with in our bodies. Those have a lot of negative effects. If you take DDT, it was known back in the early 1950s, DDT was showing these types of effects in animal models. The studies kept accumulating and accumulating, but we didn't ban in this country DDT. It's still used in a lot of parts of the world until the 1970s. Then the pesticide that DDT was replaced with, millions of more people exposed to it, that was banned 20 years later when that was found to be harmful. So to your point, Devra, all the chemicals that we're dumping into our food supply and that we're breathing in our air and that are ending up in rain that's going into ponds, that's going into the grass that animals are eating, that we're subsequently eating, we're at the top of the food chain, into the fish. Where do you think the mercury's coming from in tuna and swordfish? It's coming from smokestacks. It's, cement kilns, for instance, emit so much mercury, it goes up, it's got to come down somewhere, it comes down in the rain. And the fish take it up. The longer-lived predator fish, it bioaccumulates its way up, has a lot of toxic effects. I check mercury in everybody, and probably 25% of the patients I check, if not more, have high mercury levels. They don't have any idea about it. It gets deposited in the heart, and the blood levels are about 1/400th what the tissue levels are. The tissue levels of DDT. And so industry tried to argue when people like Devra were talking about it, back then they tried to argue, well, it's such a weak estrogen, it couldn't possibly really do anything for humans. The difference is human estrogen, when it's made, it's in your body for a few hours. The half-life of DDT in the human body is over 40 years. Once it's in you, it's there for good. And there was just a study published 2 weeks ago. There's an epidemic of infertility throughout the world now, not just in this country. Epidemic. I mean, when I was in medical school, there wasn't such a thing as a fertility doctor. Now there's fertility doctors everywhere. But nobody's asking why. Where is it coming from? And a study showed that men who ate the highest pesticide-containing produce compared with men who ate medium or low had half the sperm count. It was 170 million in men that ate medium or low, but men that consumed high pesticide produce regularly, it was only 81 million. So
Wow.
Cut in half. You're infertile with that. And there are a lot of effects to this. Dr. Oz wrote the foreword to my book, and he has come out for labeling of GMO foods on packages. And so a group of doctors wrote a letter to Columbia saying that he was a quack and he recommended supplements and it was not ethical. And he wrote a rebuttal today and looked into a number of these doctors who were working for the tobacco industry, working for the pesticide industry, and
convicted of Medicaid
convicted
fraud.
of Medicaid fraud, yeah. So
Right.
we're living in a time now where people have to be their own advocates, and you have to ask questions. You can't just accept things that you read in the newspaper or what people are telling you. You must ask deeper questions about things, because if you don't question the way the world is today, things are going to get worse.
Could you please comment on the contribution of a healthy attitude to our genes and our health and well-being? And in relation to that, would a person with skepticism and negative thinking not have the same healing potential on your supplements as someone with a hopeful and positive attitude?
That's a great question. There's a whole field called behavioral epigenetics that looks into the role of stress in gene expression. The more stress, the more depression, the more pessimism you have, the more inflammation you have, the more difficulty you have sleeping at night. That disrupts melatonin, it disrupts cortisol, it promotes type 2 diabetes, it lowers the immune system. There was a study published in the Journal of the National Cancer Institute several years ago that looked at women that were recovering from breast cancer surgery. They found that women with the most stress and the most depression had the most profound suppression of the very part of their immune system, the natural killer cells, that was responsible for preventing a recurrence of the cancer. So there is hard science for that.
It only takes one incident, like Angelina Jolie's 2 surgeries, to remove her breasts and her entire reproductive organs because of a couple of markers that she possessed. So that goes viral around the world, and I don't know how many thousands of women are going to run to their doctors, look for this marker, and mutilate their bodies. I wonder if you could comment on that.
Well, I think everybody has to make their own decisions, and until you've walked in somebody's shoes, until you've counseled patients dealing with a BRCA mutation, and especially a strong family history, it's an individual decision about whether to do it, when to do it, and so I think it provides awareness. They just announced in the newspaper yesterday that there was a company in California that has a saliva test now where you can test for the BRCA mutation, which if it's negative, it may be giving you false comfort. because there are literally thousands of genes that you can influence the expression of to help protect you against breast cancer that you should be doing whether or not you're BRCA positive. Only 8% of all the breast cancer in this country is related to a BRCA mutation. 92% is due to environmental toxicants, whether it's food, white sugar, white flour, or all the other things that we've been discussing.
Right, right.
So I work with many patients who have blood cancers and are undergoing very high-dose chemotherapy. They often come in and, they're in the hospital, they're very immunocompromised, and they're very immunocompromised for a period of time afterwards. They often ask me about a lot of the supplements you mentioned in your book, and I never really know what answer to tell them because they're in that immunocompromised state. So I was wondering what you recommend to your patients in that time period?
It's really very individual. When somebody's on high-dose chemotherapy or they're in the middle of a bone marrow transplant, so many other factors come into play. Their platelet count, their white blood count, even their ability to take supplements. It's very, very difficult for them. A lot of times their guts are so compromised, it's hard to take much in the way of supplements. So you really have to take that more on a case-by-case basis. It's not one size fits all. And even in the book, I talk about how it's not a book about supplements. I do think some supplements are necessary, but it's more about just getting the right nutrients in. So for those types of patients, I would say look and see what their vitamin D levels are. That's easy enough to supplement. Look and see if they don't have high mercuries. Make sure they're getting enough anti-inflammatory type foods in. Make sure they're getting enough things to support their immune system. A lot of that you can do just with diet and diet alone. You don't necessarily need supplements.
One of the things you told me about was that several of these supplements can be in liquid form, so they're easier. They don't have as strong a taste, and it's easier because some of these patients, as you know, have mouth sores. They can't swallow as well. So putting things in a liquid form, can help as well. But it's interesting to hear you talk because I see the two parts of your mind working at the same time. There's a scientist who knows all the details of how different things are detoxified and conjugated in the body, but also as the doctor, if I may say the loving doctor, who knows that each person is unique and needs to be treated as an individual. And it's wonderful. I would say again, this book is an amazing book because the stories are the stories of people who nobody else could help. And Mitch was really able to make a huge difference in their lives. Other question?
What is your position on root canals? It's my belief that infected root canals are involved with cancer also.
Well, if you have defective root canals, any focus of infection in the body is a focus of inflammation. So just as I said, dysbiosis in your gut is a focus of inflammation, so are root canals that have gone bad. And it's very important. You may not be able to deal with every focus of inflammation in the body, but again, you can put certain nutrients in your body that are very anti-inflammatory and antiviral and antibacterial. So you take the properties of garlic, for instance. Garlic is loaded with antibacterial and anti-inflammatory properties, and it has substances that induce apoptosis. Apoptosis is normal cell death. Most cells, when they get old, they'll die, make room for new cells. Cancer cells become immortal. They just keep dividing and dividing. There are all these nutrients that will induce apoptosis and are anti-inflammatory. Oil of oregano and rosemary contain carnosol, profound anti-inflammatory, have antiviral, antibacterial effects, and pro-apoptotic effects. So nature has given us a lot of the answers. It's just a matter of putting it together into a plan.
I want to remind you something. When my family went to Tibet in 2002, I said to you, what do I take? Because in Tibet, you have no medicine. I mean, there's no Western doctors. There's nothing. We went up at some altitude, and I don't. Do you remember what you told me to take? Because we took everything we took from you. We used, and it was some very basic stuff, it was grapefruit seed extract and oil of oregano. And they were like the all-purpose, everything, because in fact, the interesting thing is grapefruit seed extract and oil of oregano, now in laboratory studies, they kill just about anything. They kill any bacteria, any fungus, any virus. And of course, these are really nasty tasting things, I have to tell you.
And cancer cell lines that
Now,
they've been testing.
they're being studied now that they kill cancer cell lines. But it was really, we couldn't carry a lot of stuff because we were, and it turned out to be very, very important advice. And we ended up using the entire, everything we took because your advice was so well. We have a question up here, and okay, go ahead.
Do you think that iodine deficiency, or do you test for iodine when somebody has breast cancer?
I don't usually, unless I suspect there's a reason somebody should be iodine deficient, and I don't really recommend patients empirically take iodine because the potential for doing harm from that in terms of your thyroid gland outweigh any potential benefits, and iodine deficiency is much less common than some circles believe it to be.
Yeah, hey Mitch, I just wanted to get your view on low-carb, high-protein diets, which have become incredibly popular in this country because they seem to have some benefit in losing weight. But I want to know how they stand from the perspective of cancer.
It's a great question. And so there are all these fad diets out there. You mentioned low-carb, high-protein. Low-carb, high-protein diets really tend to be low-carb, high-saturated fat diets, which really isn't what you want. Then there's been the bias against any grains, unless you're gluten intolerant. That's not necessary. So the reason most diets don't work for the long term is because they leave you deficient in some way. They'll leave you deficient in anti-inflammatory nutrients. They'll leave you deficient in nutrients that can help healthy insulin levels. They'll leave you deficient in things that help the good bacteria in your gut. I could name 20 deficiencies that I talk about in the book from all the fad diets over the last 30 years. What all of them do, the analogy I use, it's like trying to repair a leaky roof by digging a deeper and deeper hole in your floor. You just keep getting yourself into a deeper hole. And that's why people get so frustrated. So I recommend the rule of thirds. And that's really formulated on the best science. I back it up, especially related to gene expression. The rule of thirds is very simple. A third of your calories should come from healthy protein, a third should come from healthy carbs, and a third should come from healthy fats. So the healthy protein sources are things like eggs or egg whites, fish, lean meats, raw vegetables. They're loaded with protein. People don't realize that's why juicing's so good. Raw vegetables loaded with protein. Lentils loaded with protein. Then for carbs, whole grains are very important. Whole grains are broken down in the gut to short-chain fatty acids, not processed grains. Stay away from the multi-grain label, because usually that is a code word for processed. Have to read labels carefully. Swiss cheese, good source of carbs, nuts, fruits. And then for the healthy fats, you want about a 3-to-1 mix of omega-6 to omega-3s. Best omega-6s, olive oil, one of the best things. You should have olive oil every day of your life, extra virgin olive oil. It's best not to cook with it because when you heat it, it denatures a lot of the good nutrients. Tons of anti-inflammatories, really good quality omega-6s.
What about coconut oil?
That was the next thing. Coconut oil, loaded with great omega-6s, loaded with lauric acid, which is anti-inflammatory, very important for your immune system. That's the best cooking oil because it has the highest smoke point. It doesn't create a lot of free radicals that are going to promote inflammation in the body. So the best cooking oils are coconut oil or cold-pressed grapeseed oil or even butter or ghee. And then for your omega-3s, the cold deep water fish, or you can get it from chia seeds. By weight, chia seeds have 8 times the number of omega-3s that the same weight of salmon does. And you can also get it from flax seeds, which have to be ground, pumpkin seeds, all good plant-based sources of omega-3s.
Very good.
Thank you so much.